Some of my most popular videos are about how to dilate quicker, but I know a lot of you just want to take that pill and lay in the bed and let it work for you. But I'm here to tell you that just like I absolutely hate working out every single day, I still get up and do it because I know how important movement is. Now, mine is to build bones, but today I'm going to talk about why movement and dilation are BFFs. So let's talk about it.
Attention, attention. Paging the pregnancy nurse. She is a nurse, but not your nurse. Thank you.
And in the labor and delivery room, and honestly, my entire 30-year nursing career, I've seen how when you are in pain, you don't want to move around. I 100% get that. But you got to do it while you're in labor. So if you've seen my stages of labor video, you know that there are two big stages of labor itself. By the way, I just re-sewed the eyeballs back on this guy. Do you think he looks any better? He's my buddy. We should name him. Do you have a name for him? Tell me down in the comments. So we're in early labor and compared it to a cork, trying to fit a cork back into a bottle of wine. And so they are small movements where you're just trying to wiggle the baby into the pelvis, right? So you're thinking those small movements to get that cork in there. Things that can be like hip sways, curb walking, honestly, even just shifting positions in bed. You're trying to get the baby into their best position. By the way, while we're here talking about movement for this baby, don't forget to do your kick counts. I'm a huge fan of kick counts. I haven't promoted them lately, so I wanted to be sure that you knew how to do them correctly. I'm going to leave my cheat sheet on how to do them and a reminder that it saves 1 out of 3 stillbirths. Again, you can find it down in the description. So once that cork, aka the baby, finds their best position in the pelvis, now is the time to give those big movements to help it descend. So, you're wiggling the cork into the top of the bottle. You find the right position. It's seated well. That's when we get into active labor and you push down hard for the cork to go back into the wine bottle. Now, these are times that you're going to want to open that pelvis to allow your uterus to be, this is the thumb that pushes down on the cork bottle to get it to reseal the bottle of wine. I don't know how far this analogy can go, but at this point in time, you're wanting that uterus to really push down and you're trying to open up this pelvis more to let the baby into the birth canal. By the way, in the online prenatal class for couples, there are labor movement cards because it can be really easy to run out of ideas on how to move. And so I think those labor movement cards can help give you ideas. It gives you tips on when to move and how to move and tips for your partner, which can be really helpful. I will link that class down below. Now, how do you get that pelvis to open up? There's lots of different ways. You can sit up in Buddha pose or throne pose. I guess I like throne pose better, but a lot of people know exactly kind of like how Buddha's sitting up. So that's one. You can use a peanut ball. A lot of hospitals have those. It's a great question to ask on your hospital tour if they have peanut balls. If they don't, there are some cheap ones available on Amazon, but that's just a way to open up your pelvis and can be great if you have an epidural and you're laying in bed. What you're trying to do in that case is to open up that pelvis to give the baby as much room as the uterus pushes down on it so that it can descend well, which will, in fact, dilate your cervix. Now, I see far too often online that people act like there is one way to do this, that, you gotta move your pelvis outward or inward. And I'm here to tell you that everybody is totally different. What you're doing has to both help you relax and open up your pelvis. And some of the poses that they recommend online, people just can't relax in. A lot of times those poses where your knees are in, I see that people just can't really relax very well in them. And so, everybody's different. So my best tip is to try lots of different things and to utilize that labor nurse as the MacGyver that they love to be. Your labor nurse wants to help out so much, but sometimes you got to invite them and say, hey, I would love to move around a lot. Because the fun fact is there are patients who absolutely do not want to move at all. And as a nurse, when you're trying to move a lump of nothing, especially if they have an epidural, it can be really frustrating. So if you're like, girl, I would love to move, she's going to be like, girl, I got you. Let's flip you like a rotisserie chicken during this labor, right? And you can become an amazing team. You just sometimes have to invite them in. Now, this is a great job for your partner. So some tips for them is to set a timer on their phone, and for every 30 minutes, as long as you are not actually asleep, to help you move into a position. And that's the other tip, to help you. Your labor and delivery nurse, especially if you have an epidural, can only help move you so much. So a lot of times she'll have to get a buddy to come in the room to help reposition you if your partner isn't willing. But if they stand up and they're like, tell me what to do, I want to help you move her, this isn't brain surgery, they can 100% help you move, then you are going to get moved more often because that nurse can do it with your partner. And they can have those labor movement cards there to help you with positions. This is especially important before you have an epidural or if you are not getting an epidural, which I absolutely love. And, that just gives you ideas because especially if you are the one in pain, you are not an idea factory. So having those labor movement cards can be really helpful. And quick reminder, this does not come naturally to partners. They need help in these situations. And so make sure that you're giving it to them. I recommend taking a class that involves your partner. Again, I will link the class that I recommend down below. Now, if you're like, great movement, but what else can I do to dilate faster? I actually have a whole video on dilating faster. I'm going to link it up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.